Hello everyone, Dr. John Bartemus here today to dive into a question that we should all think about and get an answer to. And that question is, are hospitals safe? It seems like a rhetorical question with a simple yes answer and kind of a ridiculous question to most. But really it is not a simple answer, and the more that you read, the more that you find that hospitals are not safe. And you should be very wary about going to a hospital to get the state-of-the-art evidence-based care that they market to you, but that studies are showing that you are not in fact getting. So we'll look at a few sources of information that are peer-reviewed and evidence-based to answer the question, are hospitals safe? The first source I want to look at is a book right here called How We Do Harm. And this book was written by Dr. Otis Webb Brawley, who is very well known. He is the Chief Medical and Scientific Officer of the American Cancer Society, and he is an oncologist with a dazzling research career. And he writes this book to talk about how healthcare in America is money driven and that hospitals are not safe for many reasons. But let me just read you the inside flap to pique your interest. How We Do Harm exposes the underbelly of healthcare today, the overtreatment of the rich, the undertreatment of the poor, the financial conflicts of interest that determine the care that physicians provide, the insurance companies that don't demand the best or even the least expensive care, and pharmaceutical companies concerned with selling drugs regardless of whether they improve health or do harm. So right there, you can see that the healthcare system, which is wildly inefficient and financially sinking the country, you can see reasons why. Because it's not based on providing the best care and getting you healthy. It's based on bringing in the most money for those involved, regardless of what happens with the patient. And that is why America is sinking financially and from a health standpoint. Okay, so one more quick paragraph here. How We Do Harm pulls back the curtain on how medicine is really practiced in America. Dr. Brawley tells of doctors who select treatment based on payment they will receive rather than on demonstrated scientific results. Hospitals and pharmaceutical companies that seek out patients to treat even if they are not actually ill, but as long as their insurance will pay. A public prime to swallow the latest pill no matter the cost, and rising healthcare costs for unnecessary and often unproven treatments that we all pay for. So as the Obamacare Affordable Health Care Act is being pushed through and about to be implemented in January, you need to think about, is free care even worth accepting? And even when the care wasn't free, when you were paying out of pocket, you haven't been getting what you've been paying for, based on this book and on this latest 2013 study out of the Journal of Patient Safety. And this journal sought to find updated numbers on what are the total number of preventable adverse events in hospitals each and every year. In the 80s, the Institute of Medicine put out a study that said hospitals were causing 98,000 deaths per year that should have been preventable. Now, this study updates that number, and what they found is that there's over 440,000 deaths per year in the hospital that were preventable, but they were caused by errors of omission, commission, misdiagnosis, or lack of communication between doctor and patient. So that's 440,000 people in the country that are dying prematurely because of hospital costs. That number, if you take away deaths and you just say how many people are seriously harmed but not lethally harmed, that number jumps to 2 to 4 million people a year are injured by hospitals. And these injuries could have been prevented by better care, more focused care, better information gathering, better communication in the hospital. So a few statements from the article here. We quote, "Premature deaths as a result of medical errors may occur many years after the hospital stay because the patient's care was not optimal or did not follow guidelines." So just because you didn't die while you were in the hospital doesn't mean that you got out scot-free. They may have messed things up that are killing you slowly and will not actually manifest in death until years later. but you're still losing years of life because you're dying prematurely due to their mistakes. Medical errors, lethal diagnostic errors have been estimated to affect 40 to 80,000 people per year, including outpatients. Physicians have been indefensibly slow to adopt guidelines that would potentially prevent premature deaths or harm. So basically, if you think your doctors, especially in the hospitals, are up to date on the best standards of care, this study is saying they absolutely are not, and they've been indefensibly slow at incorporating the best standards of care. So if we look at Dr. Brawley's book and we say they're just doing things based on finances, then why should they even stay up to date on care if the pharmaceutical company is going to throw them kickbacks, or the insurance company is going to pay for the most expensive treatment given with no questions asked? Then why not just do that, get paid, and not worry about it? And another thing that allows them to do that is that adverse event reporting is very, very poor in the hospitals. And a recent national survey showed that physicians often refuse to report a serious adverse event to anyone in authority. So even if you go to the hospital and something bad happens to you, they're not going to report it. Okay? So you're on your own. It says, in the case of cardiologists, which is the highest non-reporting group of the specialist studies, so you're going in for open heart surgery or some sort of heart treatment, this cardiologists are the highest group of non-reporters. So if something bad happens, 2/3 of them said that recently an adverse event occurred and they did not report it. So 66% of cardiologists out there will not report an adverse event that was their fault and that was preventable if it happens to you. Lastly here, quote, 440,000 preventable adverse events that contribute to the death of patients each year from care in hospitals occurs. This is roughly 1/6 of all the deaths that occur in the United States each year. So conservatively, hospitals are the number 6 cause of death in the country right now. Heart disease, cancer, obesity, and then the hospitals are at number 6. The problem of preventable adverse events must emerge from behind the wall of silence and be addressed for the sake of prolonging lives of Americans. Increased participation by patients in their healthcare decisions is one way that we could help with this. Perhaps it is time for a national patient bill of rights for hospitalized patients that would empower them to be thoroughly integrated into their care so that they can take the lead in reducing their risk of serious harm or death. So basically what that's saying is, as a patient, you need to do what I tell you each and every week. You need to educate and empower yourself about health and about whatever issue it is that you may be facing, because the doctors are just going to white coat you to death and say, I'm the doctor, listen to me, just like they do with vaccines. Okay, so you need to go in educated. The authors of this article say you should bring in a patient advocate with you, so a spouse or a friend who, if you have surgery or have to go under anesthesia and can't think clearly, you got to have someone there with you that you've pre-gamed with and discussed, hey, this is what I will allow, this is what I won't allow, and don't let any of these things to happen to me while I'm in there. So that's one way to address it. So I think we've answered the question. No, hospitals are not safe. Okay, 1/6 of deaths in America each year are due to preventable adverse events in the hospital, and up to 4 million serious harms are done per year in the hospital that could have been prevented. So what is the answer? The answer is not to go to the hospital. Live in such a way that you're not going to the hospital unless it's absolutely necessary. And this brings up a simple analogy for me to share with you, and it's the firemen versus the carpenter analogy. Let's look at the hospital and the quote-unquote healthcare system as the firemen in the equation, and we'll look at chiropractors as the carpenters in the equation. Now, your body is your house. Okay, so if your house is on fire, who do you call? Do you call a carpenter or do you call a fireman? You call a fireman, right? And the fireman's going to come and the fireman's going to use the tools they have, axes and fire hoses, drugs and surgery, to bust out all your windows, bust down your doors, spray down the inside of your house, put out the fire, and save your life. And that's their job, and they're good at doing that, and that's what we need them to do, but they need to be better at not ending our life prematurely by a preventable mistake, okay? But say they save your life and you get out there without a preventable adverse event. The next day, your house is still in shambles. The doors and windows are all broken. It's all wet inside, okay? So are you going to call the fire department to come back and do the same exact thing? No, right? Because that's not going to restore your house to health. Well, then why would you take a pill every day or continue going back to the hospital to try and regain health when that is not their business? Health and wellness does not come from the hospital or from a pill. That's where the carpenter comes in. The carpenter comes in and installs new windows, installs new doors, paints the walls, paints the eaves, takes care of your house and fixes your house, and restores your house to health and to wellness. And that's where chiropractors come in. Chiropractors restore your body to health and wellness after an adverse event. So if you get hit by a bus, don't come to me to get adjusted. Go to the hospital, get your bones set, get your life saved. But then once you're stable, you don't need to stay in the hospital. You need to come to me, and we'll get you restored to health and wellness through chiropractic adjustment, reconnecting your nervous system with all of your cells, organs, and tissues, the communication there. We'll get you on nutrition that's going to heal you, decrease inflammation, and normalize your physiology. And we'll get you back on a fitness program to restore your strength and get you back in a healthy, happy mindset. I'm Dr. John Bartemus, and I hope we opened your eyes a little bit to the current state of healthcare today and what the dangers are in trusting the hospitals and outpatient centers if you're seeking health and wellness. You don't find them there. You find them at the chiropractor's office. And I'm here to join with you on your health journey and help you achieve that health and wellness through natural methods. Have a great day.